I'm Sonal. I'm a second-year resident here at Montefiore. I was born and raised in Queens, currently living here in the Bronx. The main thing for me in terms of choosing a residency program was the vibe that I got when I got to the program. Each program is really different in its own way, and kind of the sense that I got when I first interviewed here was the sense of family, a sense of closeness, and everyone just seemed really, really happy. And ultimately, that was the main reason why I ended up choosing Montefiore, and I'm really glad that I did. I just finished my intern year, and so I started my second year of residency. And what happens your second year of residency is you're kind of split into two groups. There's 12 people in a class, so 6 of us are doing a rotation at Bronx Psychiatric Center, which is this chronic state hospital here in the Bronx. There are patients for 6 months, and actually it's a place where you learn to do psychotherapy. We meet our patients once a week for 45-minute sessions. And it's a chance for us to really hone in on our therapy skills. One thing that I love about Bronx State is kind of the trips that you do with the patients. You get to see patients in a different light. So I've gone to Yankees games with my patients. I've gone to the aquarium. We're going to the Bronx Zoo this Wednesday. So it's a chance to see them outside of their environment within the hospital, and it's fantastic. You see just this different side of them that, a sense of, when you're in the hospital, you get the sense of, some institutionalization, but when you're outside of the hospital, they're just like everybody else, and I happen to love it. I'm from New York, but I didn't think that I was going to live here, but I'm really, really glad that I chose to live here in the Bronx. One thing about Montefiore that's great is they offer on-campus housing to incoming residents, which is about a block away from the hospital, which is, I think, great. I happen to not live in housing. I live in an apartment with actually one of my co-residents, about 2 blocks away from housing, but a 5-minute walk, if that, to the hospital. And living in the Bronx is really, really cool. We've done a lot of really interesting things here in the Bronx. You can go to a lot of Yankees games here. Yankee Stadium is maybe 15 minutes away on the 4 and the D train, and Montefiore happens to be close to the 4 train and the D train. The Bronx Zoo is here, the aquarium. There's a ton of parks around here. Van Cortlandt Park is great for hiking, biking. That's what I've been doing actually all summer. My favorite rotation was actually during my intern year. It was my time on the inpatient psychiatric unit. The unit here is called Cloud 2. It's an acute inpatient setting where patients get admitted from the POS, which is our psychiatric emergency room here at Montefiore, and other hospitals as well. And they come up to the inpatient unit, and it's a chance for us to kind of work out their medications, provide them a little bit of therapy, some family work, and stabilize them enough to get discharged out into the community where they can get set up with their outpatient providers. What I really loved about it was the support that I got from everyone on the unit while I was on my rotation, not including my co-residents, who were fantastic. We all bonded during that experience. We got really, really close. But also the attendings that I worked with, the social workers, the nurses, and the ancillary staff, everyone was really fantastic. They supported us, and they really made us feel very welcome, and I felt taken care of on the rotation. Lecture day is 1 full day dedicated to the residents. It's called Didactics Day. It's a Thursday every single week. It's a chance for the residents to get their lectures for the day without it being split up, and it's protected time. You have no clinical responsibilities during the day, which was a huge plug for me when I first came here, because it gave me a chance to kind of consolidate all the information that you learned during your rotation during the week, but in one lecture day. You get lectures on psychopharmacology, you get lectures on psychotherapy. It's a chance for you to talk to the psychiatrist or the psychologist who are giving the lectures and ask questions. You have grand rounds on that day, and you get to see everyone else in your class, which is also great. One thing that I also really love about lecture day is T group. It's a group at the end of the day. It's a process group where A psychologist or psychiatrist moderates the group, but it's a chance where you get together with your co-residents in your class and talk about what's been going on in residency, what's been going on with your patients, what's been going on just in life, and it's a chance to process your feelings, and it's a chance to really see how everyone else is doing. So the work-life balance at Montefiore, I think, has been really great for me. Intern year in general is a daunting experience for any intern when they first start residency, but I thought the hours are actually pretty manageable. So you are working a lot, but I think you have a lot of time to do what you want to do outside of work. I've never felt that I've been at work all the time and that I couldn't do anything that I wanted to do. In terms of the call schedule, I think that's been pretty manageable. As an intern, you're working a little bit more in terms of the weekend days, and so it's a little bit harder in terms of trying to schedule some things, but as a second and third year, you do calls overnight and you get your weekends free, which has been actually really, really fantastic. Clinically, the patient population here in the Bronx is really, really diverse. Starting here, working at Montefiore, I wasn't sure where I wanted to end up down the line, and working with this patient population has made me realize how much I like working with this particular demographic in terms of the socioeconomic factors into it, the family dynamics of the patients that I see, the different pathologies that you see, and really has made me realize how much I want to stay in the Bronx and work with this population. In terms of career plans for when I complete residency, I'm not quite sure. I know that I want to work in the Bronx, and I think Montefiore really helped me realize that. I think I want to work with this population. I've really enjoyed my time here so far. In terms of what I want to do versus inpatient versus outpatient or in the emergency room, I'm not quite sure because I've actually enjoyed pretty much everything so far. And I'm really looking forward to the second part of my second year where I get to experience a lot of the elective rotations in addiction and geriatrics, child, and kind of see where my interests go from there.